Great, thanks. Did it work earlier? Did you try before I came over here? Oh, it's working. It's working now. Yep, we got it. We're in. All right, Dr. Malone, we're here again. We're on YouTube Live tonight instead of Facebook. And it is the 6th or 7th of, I'm losing track of the days.
7th.
I'm hearing an echo. Thank you. 7th of April. And Dr. Malone, what has happened in the last 24 hours that we can bring the local community up from the COVID standpoint?
Locally, I guess the news this afternoon was that they're confirming that there are, I guess, 8 cases in the long-term care facilities, which I guess that's concerning because the long-term care facilities is where you have some of the most at-risk parts of the population as far as age and other risk factors. So that's concerning, and I guess statewide, we have about 2 or 3% of that long-term care facility population that's infected here. So that was concerning. As far as the numbers, we went from 141 to 168 in Escambia County. And I was going to share with folks on here what our the county website has got going. That's when we first started doing these a few weeks ago now. I'd always referred people to the county website, and there's been some nice improvements and implementations on here. So I just switched over to this now. And so that 168 was updated just this afternoon, and important to note that on there, the hospitalizations and the deaths. And the caveat there being that there's not 15 people currently hospitalized. They've been hospitalized over, the last couple of weeks. So right now, for a snapshot in time, there might be like 8 people in the hospital in Escambia County that are infected, and some of the people have been discharged, or we know 2 died, obviously. So that's a ongoing total. They haven't gotten to the point where they're being able to give you a current total on the hospitalizations. But I wanted to let people know to go to these sites, the Escambia County site. We'll link it today on the video. It's got a lot of useful resources on here, and they're very easy for the general public to understand, and a lot of good frequently asked questions and resources on there. So I would recommend checking that out. I personally have used that COVID-19 at flhealth.gov email, and I got a response probably within 1 hour. It wasn't, dear Dr. Malone, it was somewhat auto-generated, but they did answer my specific question without just giving me a copy and paste of all their information on the disease. So I will vouch that that's something that you would want to check out.
Okay. I saw something that just came over my phone about the nursing homes, assisted living facility. I can't remember which one it was. There was eight people diagnosed with it in that facility, in that one facility. Is that right?
Yeah, and some of them are personnel who work at the facilities. So this is, if you remember back when the Seattle or the Washington State cases came about way back when we thought like, hey, this is the first case in the United States. It was basically a tinder box. It was a nursing home, and it was catastrophic, the amount of people that died in the one nursing home from the one introduced infection. So yeah, so really that's the scary part. Every time we've been seeing these numbers go up every single day in the community, this is the one that's, and even when you see a death in the community, yeah, that's no fun to look at. But when you see it in a long-term care facility of any sort, that's something that I think I would hope that the facilities and the Department of Health are involved to the point of isolating who these people are and trying to track their contact trail as best as possible to try and cut this thing off at the pass if possible.
And what's the data on the testing locally? Do we have any stuff on that?
So locally, Escambia County had 2,700 tests that have been reported as being collected to the state, 168 positives, so 6.2% again. Of those positives, we just talked about the people that have been hospitalized, 15 total since this all started, and then 2 deaths. And then the city of Pensacola is reporting 121 cases, Gulf Breeze 12, Pensacola Beach is 1, at Milton 25, and Pace 7. I think I got most of the immediately surrounding areas here as far as the amounts that they're recording. So not a whole lot of movement on the beach or Milton or Pace, but certainly Gulf Breeze are going up. So that's the local numbers. The other thing that I saw, and I think this was quoted on one of the Department of Health websites. If you recall back when we started doing this, that the available ventilators, I think we mentioned this yesterday, in the county was like at 147. And I said, there's room for error moving upwards. And I think that they've gotten a more comprehensive assessment of what's available. And that was probably the anesthesia machines that are being purposed for ventilator use in the ICUs. And also Select Specialty Hospital, which is a long-term acute care hospital. They don't have an ER, so you don't get admitted to the ER, you get transferred to facility. Their numbers are included in this. So starting at 147, now it's up to 218 available ventilators. So that's good news. And I would say that that's probably knowing that they're maxed out at that point before having to get to the real extreme situation of splitting ventilators or purposing BiPAPs and things like that for ventilator use. So that was good news to see that they're publishing the data and trying to, I guess, keep track of what their possibility is. Furthermore, there's just over 1,300 beds available in Escambia County. I mean, hospital beds, not just ICU beds. And I think the last check I saw, like there's more than 50% that are available at this point. And that's probably on account of not having any elective procedures where people would be going and staying for one. Yeah, any of those things. And, I know you and I chatted last week that you have a relative who's an orthopedic surgeon who's seeing what would otherwise go to an ER at the orthopedic clinic instead. They're being turned around from the ER doors with fractures, and they never even walk into the hospital. They go to the outpatient clinic and get their x-rays and get taken care of. And, these are people that with any kind of alarming finding or what have you, they're probably going back to the hospital if they need to. But I think that you get the specialist to lay eyes on them now instead of, hey, we'll admit them overnight and have the specialist see them first thing in the morning. So I think that's probably also helping free up some of that bed space, which is advised in knowing everything that we know right now.
What do you tell a person that's having symptoms? They got a little cough, they wake up with a little fever, let's say it's 99, 100, they got a little tickle in their throat. When do you think is something that should be tested?
I think if you have those symptoms right there, the fever symptoms, cough, and or some of the shortness of breath, or like the myalgias or the lethargy, I think that right there would warrant a phone call to the hotline that's available on that county website we mentioned, so that they ask you more pointed questions than about if you need to be tested, because this is still not to the level of where you just show up to a test site or you call your doctor. The doctor is going to say you need to go through the county so that it's a consistent testing. So those, I really would tell people, you need to be really pursuing, make that phone call. And let's say you don't pass the criteria to get tested, you're still in their system. And so then a day later, when you call and you say, hey, now I have all these new symptoms, chances are they're going to say, yeah, you need to be tested. This fits now. So I would err on the side of caution on making that call. And everything I've heard is that they're very responsive and very available with the hotlines that are in place at all the different testing facilities locally here. And so I would not try to be stoic in this setting.
Yeah. Now, how much of a fever does it matter? Like, if somebody's under 100, do they even have a fever? Or
initially they were saying like over 9, but technically I could get 99 if I was outside working in the yard,
right.
and just a little bit dehydrated. So I would say if you've measured yourself a few hours apart and you're consistently over like 99, 99.5, then that's enough of a fever with the other symptoms that I wouldn't ignore it.
Okay. From I guess I'm not asking you to be hyper technical, but why is it that some people respond to the treatment once they're like sick? Why do 80% of the people get through this and 20% do not? If you exclude the risk factors, let's just take somebody that doesn't have any of the risk factors, younger person. Why is it that some young people with out risk factors, or 20% of them go downhill and 80% of them don't? Why is that?
So that's a good question. I did a lot of reading on this actually today, trying
Okay.
to prepare or just learn myself about, because it's a tough question to answer. So right now there is no good answer. There is a theory, and the theory is that the people that decompensate, usually in that second week, that were otherwise healthy and that looked like they had licked this thing, it's maybe not because of the actual infection itself, but the body's response to the infection. And so that's what you're seeing in the headlines now, called cytokine storm syndrome or cytokine
Yeah, I heard
release
that last
syndrome.
night.
Yeah.
Cytokine is some body chemical that responds to infection. Is that what that is?
Yeah, but almost in overdrive, to the point where the response can be harmful to many organ systems of the body. We've mentioned before renal failure. These are the people that are showing up with what they're calling the COVID pneumonia, where it's not the classic pneumonia in a classic sense where your lung is full of bacteria. It's where there's fluid and inflammation that is resultant of this hyper response with the cytokine release. And I found a pretty good article again, and we'll share it, basically saying don't forget about the host. We're the host, and our response is just as detrimental as the infection itself. The key thing here is that it's a syndrome, so your cytokine release is going to be different than mine. And right now, there's no way to predict what yours is going to be or mine is going to be. However, these facilities are now publishing, I guess, almost like checklists when someone comes in to try to best gauge who's about to trip into this cytokine release, because there's no, it doesn't happen on a specific day at a specific hour.
How do you control it? Can you control somebody's what do you say, cytokine?
Cytokine storm or cytokine.
Yeah.
There are treatments out there. Cytokine release really was something that got initially labeled back in the 90s, and it was with some of this immune therapy for cancer patients. And so that's where they started realizing, wow, like we're treating these people's cancer, but we're making them really, really sick, and it's different than chemotherapy sick. This is like they look like they're infected sick. So there are treatments out there that are being tried, and some of the treatments are actually part of the protocol of hospitals, and we'll get to that point next. I found a pretty good protocol, which I'll share, and it shows the reason why they're using these. But again, they're not aimed at the virus. They're not aimed at trying to kill the virus off or anything like that, or prophylax against this. These are all the lab values, all the vitals are showing that this person is going into cytokine storm, and we need to try and make this to try to minimize the effect on the body as best we can. So there are medications out there. There's some that are purposed for this, and they've been used for this again since the 90s, and they're always coming up with new modalities to try and trick the body into thinking like, okay, you don't need that much of an immune response right now. So we'll go ahead and share that the article on here, but it's a pretty good read, and it's pretty easy to digest. And as far as the labs,
what is that article in?
So this is a rheumatologist that wrote it, and he's actually on staff at UAB as well. And that was just by happenstance. I know I've been talking about UAB the last couple of times, but I honest to God, I got to the end of this thing and I said, wow, that's a really good read. And it says the authors are co-principal investigators, yada, yada, yada. And he's a division of clinical immunology and rheumatology at UAB.
Okay. Well,
so,
and you didn't go to school. Just to be full disclosure, you went somewhere else.
Yeah.
So,
I have no tie there.
Yeah. Okay. So the other thing I saw last night, Chris Cuomo, who works for CNN, he's got it, and he's still doing his show from his basement where he's quarantined. And he was saying, and I know that he's doing. If I had it, I'd be calling you and everybody else I could possibly get a hold of, right? He's probably got access to a lot more people than me. And he's calling all these people trying to figure out what is the best thing for him to do and not to do. And he said something like, this virus likes to thrive on people that are not moving and not breathing and exercising their lungs, and not exercising, because he said that's not good for you, but exercising their lung tissue. Like as soon as you get in bed and just lay there, it's going to just like take over your lungs. Do you think there's any truth to that? That if you end up with a case of this, that it's not necessarily good to just lay there and shallow breathe, he's making himself like do the pulmonary exercises where they are respiratory therapy type exercises where you actually inhale completely and exhale completely, and to try to work his lungs to keep, he thinks is keeping the virus from spreading in his lungs. Do you think there's any
there is some
scientific basis?
There is some truth to that. There is some truth to that, and I won't say that it's to stop the virus from spreading. It's to stop the insult on that tissue. So this is something that's called, the term is called atelectasis, and that's the lung tissue collapse. So normally in a normal day, you're at your office, you're walking up and down the stairs, you're inactive, you're using a good majority of your available lung tissue just to do those activities. Now you do that every day, and all of a sudden, if I were to say you're not allowed to get out of bed for 2 days straight, 2 days later, your lung would look different on a chest X-ray already. That's how fast it happens.
Wow.
So in a hospital setting, for anybody who's in the hospital, especially for an infection and a pulmonary infection, you see these incentive spirometers. It's like a little game next to the bed, and it's got a little blow tube. But they're not blowing; they're sucking when they do that. They're inhaling, and they're trying to keep the little ball floating at a certain level for so long. Do that so many times an hour. And that is to keep the lung tissue expanded, to keep it so that it's not compressed and compromised. And it's not, I mean, yeah, the idea is, oh yeah, it's going to be a stagnant pond in there and bacteria is just going to set up shop, or virus set up shop. Is to keep that tissue healthy and working and oxygenating your blood, so that when and if you get more ill for whatever reason, the infection is not under control, your lungs are there doing their job. So
what does somebody use at their house to do this if they don't have that? What do you call that device again?
The incentive spirometer. So you don't have that. Some people surprisingly do, because they had like an elective surgery and they took it home with them, and you can pull it back out. So other things are you're focusing on the inhale, not the exhale. So you want to make sure you're getting a full, so like think of like yoga breathing, the things that you do for like meditation, and you're doing it to a degree where you're inhaling, holding, counting to 10, or and then letting it out slow. You can look at a watch face and say, I'm going to breathe 4 times this minute, and have a slow inhale, hold it, exhale, and then again. So every 15 seconds you're getting a breath. You don't normally do that, but you're actually forcing your whole lung, or the majority of your lung, to expand in doing so.
You can't buy those at like a drugstore or anywhere. Those spirometers.
You might be able to get them at a medical supply store. It's not something that you can only get if like you're a doctor or a hospital.
Right.
So you may be able to find something like that. I can't vouch as to the quality of the device. Of course, in going to get that, you'd be putting yourself out that for an unneeded trip to the store necessarily. So for someone like Mr. Cuomo, if someone can get him one, that'd be great. Otherwise, to do what he's describing, I think that's fantastic.
Right.
And if you have the ability to do some sort of exercises in the home, whether it's going up and down your stairs, or you can go outside if you're the only one in your home, because you're not going to infect anybody, to try and do some of these mobility exercises as well, just to move around. This is times when, if someone's been doing yoga kind of stuff, or some of these online, say, find a YouTube one that's focusing on breathing and do that, and that's would be a whole lot better than laying in bed.
Right.
I know my wife online yoga things, and there's some videos out there. So the way to turn something into a useful exercise.
The hard part is you feel like crap, I understand, and you feel worn out, but you have to make yourself do these breathing exercises to help yourself, if your lungs get worse, that's not good for your prognosis becomes a lot worse if your lungs stop working.
Yeah, and I would set an alarm, because ideally, if you're confirmed ill, no one's supposed to be in contact with you. So you're not like you like say, hey, to your other family members in the house, come and wake me up and remind me to do these breathing exercises. They shouldn't even be in contact with you. So set an alarm on your phone, remind you to do it. You want to get some sleep so you can rest, but during your non-sleeping hours, during the daytime, you really should be doing it once an hour. And to do this for the first 5 minutes of every hour is worth doing. Even if you don't feel well, you can sit up, you can stand up, you can do these breaths, and then make sure you don't overdo it and pass out, and then lay back down. And that's a whole lot better than laying on the couch for 16 hours in one day.
That medical journal that we looked at before we got on the air, what was it in reference to?
So you had mentioned, and let me get that pulled up here real quick. Yesterday, you were kind of concerned, or you're not concerned, you were curious as
It's a good
to,
word for me.
what's going on in these ICUs and
Right.
there, and I'll share this with you, and you can see it. So uh, this was in New England Journal, and it's
All this
they
stuff is
had
like
a
brand new, right?
yeah, well, the release this happened a few weeks ago, and now they're publishing this stuff. So this is in the Seattle region where we had the first major confirmed outbreaks.
Uh-huh.
And so what they did is they tracked 24 patients across the greater Seattle area that were admitted to the ICUs. And basically, when you said, "Man, these people making it out of ICUs is pretty grim," well, they had 24 patients that they identified that got admitted to ICUs. 12 of them died
Wow.
between day 1 and day 18 of being in the ICU.
Wow.
And they qualified it. They said, 4 of them were people that showed up with do not resuscitate orders before even coming to the hospital. So maybe they were people who'd been through illness before, so that they didn't have a good chance of survival. So that's one caveat. But then the other 12 that survived, 5 were discharged home, 4 were discharged from the ICU, but they
3 are
remained in
still
the
on a vent.
hospital. And yeah, at the time that they published this. So to know that 24 people got admitted to the ICU, and at the end of the study, because they cut it off at a certain point, 5 went home. It's I don't I'm not laughing at that. I'm just it confirms what you had mentioned yesterday. This
Right.
puts a face on it.
Right.
So this is understandably just raw data. They're not trying to apply to anything, and the idea is we'll get more data from perhaps New York City or New Orleans or something like that when the time is right to sit there and say, wow, this is something where instead of, 5% chance of survival, maybe a 50% chance. But even then, it's pretty grim if once you go into an ICU, no matter the reason. So
Mhm.
anyhow, we'll share this as well today. And then
One of the things I heard today was that they for all the models they've been using, they're using a 50% compliance rate for the public to the mitigation strategies, and they think that 50% might have been low, uh, and they think that Americans are doing better than that. They think Americans, might be below that. Well, it would be below for non-compliance, but higher for compliance. It would be 75%, between 50 and 75% of the people are being compliant with the mitigation strategies
yeah,
versus 50%, which is somewhat encouraging. And I guess it's encouraging only if we make progress on the antibody and the vaccine front, because otherwise, aren't you just sort of extending the time that that people get this thing? I mean, because even if you have just one person in our community that has it, uh, it's not going to be just one person. It's going to be multiple people, right?
and all signs are pointing toward this basically being like the flu, where we're going to have corona again a year from now. But the idea is that as a population, we can that a whole lot better. There's vaccines, perhaps, or there's treatment, or there's some immunity in the population that blunts the severity of it all. And then also the next time you start hearing, hey, we're going to have a bad coronavirus season, people learn early, wow, okay, like I need to be ready for this, and they need to practice the distancing. They need to frequently wash their hands, the stuff that maybe they've gotten a little bit lazy on every time they heard, hey, we're going to have a bad flu year. Because when's the last time you heard your bad flu year and really like made a big change in your life?
Right. Yeah.
So
Well,
I,
last year I did this shot for the first time because you made me.
yeah.
All right. So when you're crawling up is Pensacola running up the spike, or are we plateaued? Where do you think we are in this whole thing? Are we at the
um,
very
I,
beginning?
I think Pensacola is still going up. We haven't
Okay.
peaked yet, but we had talked the other day about where do we fall geographically when you're looking at the state
Right.
data, because that's how they're publishing this. And really, I would expect if we were to say we're going to be in the middle of all these Louisiana, Mississippi, Alabama, and Florida, I would expect it to be like in the next to 10 days, but even those peaks that they're projecting are kind of shifting a couple days here and there when you look at the publications. But I will say that some of the numbers that initially came out about how bad it could be are not nearly as bad in reality, which
Right.
to your point, where maybe some of this distancing is working.
Right.
So the other thing I wanted to share here real quick, and we made mention to it, and we'll put this up. And this was a pretty good one, and Joe knows me, I'm a big fan of these kind of charts and stuff. So this is something that never in my can I ever remember where a schematic like this is being published and updated like every 2 days. So this is Yale Medical School.
Never heard of it.
They have, yeah. So so this is they have a schematic here. If you come in to their IC or to their hospital with non-severe COVID, so you're not on the ventilator, they have a checklist so that everything is done the same way for each person, and it's all the labs. And like if you look at this yellow gold box that said COVID specific tests, well, if you look at number 3, baseline cytokine panel, angiotensin 2 level, and then they're doing repeat ones because they're trying to anticipate when these people are going to be sick from cytokine storm.
Yep.
Yeah, and then here's the people who are ventilated.
Oh, they're doing hydroxychloroquine. They're doing it.
Yeah.
As a matter of course.
For
everybody.
For ventilated patients.
Oh.
So and so they're updating this you see here is updated April 3rd. So the one before that was a couple days prior. I mean, they are updating this thing in real time.
How come they're not doing the Z-Pack with it? Just the hydroxychloroquine, no Z-Pack.
I think they are.
Yeah, because they're monitoring the EKG too. They must be.
Yeah, because of both the medications, the Zithromax as well as the hydroxychloroquine, and that's because it can put you into prolongation, QT prolongation, and
that's what it says right there.
Arrhythmias. Yeah, so this is something I'm telling you, like as they learn, they're adding to this, and this is not, I mean, Yale public, but there are other ones out there for other academic centers.
How do you have access to this? Where'd you find this?
This is on their medical school website. The internal medicine department published this, and they want other hospitals to, or any other programs to say, okay, wow, this is what they're doing, and they put the reasons why they're doing it. So if I like right here,
right,
kind of small, but it's telling you the dose that they're giving hydroxychloroquine, the mechanism, the rationale for use, and all the different considerations. And they got it on here for every single drug that they're getting in there. So if you look at this immunomodulating agents there, Joe, I don't know if you can see that.
Yeah. Yeah.
That is to hopefully combat the cytokine storm. And so they have a reason for doing all this stuff. So there's a treatment modality for everything. So, and then there's antivirals on there. So it's cool to look at, to understand that it's more than just going in and putting someone on a ventilator. There is a lot of stuff going on for these people. So we'll link that tonight so people can check it out. And I encourage you to look around and see if there's other protocols specific to hospital system you may be going to or know someone's at, because they're out there and they're publicly available. And it's not to say that's exactly how they're following it, but that's right there is their checklist, so that when someone comes in, that they get done the right way. And hospitals have been doing this for a long time. If you showed up to a hospital before all this, like in December, and had a fever, you get a sepsis workup when you hit the door, because they wanted to do everything to, hey, this affected patient who looks like they're septic. So now there's protocols for this. And I think these are not going to go away. And it's going to become one of those things where there's a COVID lab panel when someone hits the door, and the lab's going to know exactly what to run.
Very good. All right. Well, that's a very informative session tonight, Dr. Malone. You did some good work. Thanks for getting all those resources for us. You can find us on the web at zarzaurlaw.com. We're still having a fairly steady stream of car wreck cases and other personal injury cases. Fortunately, a lot of people are staying home and they're not getting hurt, but there are some here and there. We're here for you if that happens. 855-HIRE-JOE's the number. You can email us with questions about this for Dr. Malone at info@zarzaurlaw.com, or you can comment under the section of this YouTube channel. We monitor that too. We'll see y'all tomorrow with another update. Hopefully it'll be more good news, or at least neutral news. I don't know if this is great news yet or not, but it was not bad.
Our I forgot that our social distancing went from a D to a C, by the way.
Oh, see, there you go. That is good news. Yeah.
There you
Y'all
go.
have a good night. We'll see you tomorrow. Thank you, Dr. Malone.
All right, bye now.